Hi, my name's Kelly, and I'm going to be doing an assessment on my mother on the gastrointestinal, urinary, breast, testicular, and reproductive system. Say hello, Mom.
Hello.
All right, first, when walking in, you're going to assess the patient. You're going to see that the patient is sitting up straight, no noticeable grimacing or guarding of the abdomen. Take your shirt. You're going to look at the skin. The skin is pink with no noticeable scars, lumps, bruises, or rashes. With breathing, you can see the movement of the breast in the chest and slight in the abdomen. Abdomen is flat. Umbilicus is present, along with belly button jewelry. Overall symmetrical. Next, with my stethoscope, I'm going to auscultate all 4 quadrants. This is quadrant 1, 2, 3, 4. After listening to them, the bowel sounds are normal, active, and present in all 4 quadrants. We're going to assess the arteries next for bruits. Next, we're going to assess the aorta. I'm going to listen. Then we're going to listen for the renal. Right there. Then we're going to listen for the iliac. Here. And then we're going to listen for the femoral. After listening with my stethoscope, there's no bruise noted. Next, we're going to percuss all 4 quadrants. Going to have you hold that over you. Hold it like that. All 4 quadrants. Tympani is noted in all 4 quadrants, which is normal. Tympani indicates normal gastric gases. In the upper right quadrant, you will find a dullness as to where the liver will be. The liver should be 6 to 12 centimeters mid-clavicular, and 4 to 8 mid-sternal. Next, we're going to assess for the muscle tone in all 4 quadrants with soft palpation. Muscle tone is adequate in all 4 quadrants, no lumps or masses present. Second, we're going to assess for the relaxation of the abdominal muscles with exhalation. So take a breath in and out for me. As you see, the stomach rises and falls with exhalation. We're going to palpate deeply in all 4 quadrants. Here we're assessing for any masses, lumps, any abnormalities, and there was no lumps or masses, and the patient shows no guarding when touching the abdomen. Next, we're going to assess the lower liver border, palpated in the upper right quadrant. I'm going to put my left hand under to support. Hold it, Mom. Right there. Just support. I'm going to feel for the border of the liver. And it is palpable. Next, we're going to palpate on the left upper quadrant for the spleen. Spleen is palpable. I'm going to have you sit up for me. We're moving on to the urinary. Face that way. We're going to assess the percussion tenderness of the kidneys. With this, I would put my hand flat, and with my fist, you would hit hard enough just to make some sort of vibration. And there's no pain or tenderness noted when percussed. Now I'm going to teach my mother how to do a self breast examination. She's going to demonstrate the 4 positions when looking in the mirror. Face me. The first position, she's going to lean forward with her hands on her hips. Second position, she's going to stand upright with hands on hips. Third, stand upright with hands behind the head. Fourth, laterally with arms out to the side. With these positions, the breast should appear equal and symmetrically bilaterally. You're going to be looking for any contour, dimpling, color, or irregularities, which would mean a problem. Nipples should be centered and equally bilaterally. Areolas should be symmetrical and pink and skin toned. You're going to observe and feel for and note for any discharge or drainage from the nipples or areola. Observe for any skin breakdown or lesions, as these should not be there. Upon palpation, my mother's going to demonstrate how she would palpate for a self-breast exam. Oh, yeah, I'll tell you when. Yep. So she's going to raise her arm up over her head, and in a rectangle movement, she's going to move from her axillary to her sternal border, assessing for any lumps, bruises, tenderness, discharge, anything irregular. I'm going to switch sides, please. And do the same thing on the opposite side. Good job. After she assesses the breast, she's going to palpate and observe the axillary. Just going to look at her armpit and assess. On both sides. There should be no tenderness, pain, lumps or lesions or masses. No irregular coloring, rashes. You can note for hair, and no swelling. And that is all I have for you. Thank you.